Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jehangir Wellness Center. My name is Kavas Jehangir, and here from the JWC studio, today I've got Dr. Sagar Lad. He is the Pediatric Intensive Care Specialist here at Jehangirhospital and an extremely well-known figure here in Pune. Thank you so much for being here, Dr. Lad. It's a pleasure to finally have you on board.
Thank you, sir. Thank you.
First question, how did you get into being a doctor for children? It's a very specific and careful field that one needs to get into. So what made you get into it?
Yeah, actually, from my undergraduate day, I used to like children.
Okay.
And what the children are very fascinating. Treating a children is very fascinating.
Right.
Because they don't tell you any symptom. We need to diagnose the patient by seeing the activity of that child. And especially the children who are sick, who are in the ICU, the outcome are usually good. When to see the face of their parent is very fortunate or very alarming, or what we can say is very good to see the recovery of this child.
Of course.
So unlike an adult, the pediatric practice is a passion, and if you have a passion for it, just go for it.
And that's how you got into it.
Yeah.
But that's the interesting thing that you're saying. Unlike treating adults, you're not only treating the child, you're dealing with the parents and treating and healing them as much as you're dealing with the child. So it's a very complicated.
So it is not like just a medicine. We need to take care of a parent emotions.
Absolutely.
And also health. So it is a multidisciplinary.
Yeah, absolutely. That's the right way of putting it, actually. But you've dealt with so many children and parents, as you say. What are the most common things that you see that would be helpful on the preventive side for child health?
Yeah, so especially like an adult, there is no blood test that you do regularly to prevent the disease in children. It is more of a clinical examination.
Okay.
So the preventive start from the birth also.
Right.
So the main important thing is the vaccination. If you vaccinate the child, especially all the major diseases that prevent the disease in the children. Secondly, a regular vaccination follow-up. Secondly, giving a proper nutrition to the child when the child start weaning, like from 6 months onward. If you give a proper weaning, that also prevent lots of infection, lots of allergies.
That is weaning of what?
Weaning of foods, like when the baby, we start the baby to the food at 6 months of age.
Right.
But there are certain things that if you start early, like 4 months, there is a very high chance of getting allergies in the children.
I see.
So especially a proper time of a weaning. Third thing, very important, is the development. Now, majority thing, the development of the child, like what they follow, like 6 months they are sitting, 1 year they are walking, 1.5 year, 2 year they are talking. So these are all development needs to be monitored. So this monitoring is very important when you do a proper follow-up, and so that they prevent the complication later on. Majority thing is that this is a preventive era.
Exactly.
In Jehangir, we do a preventive blood test. That test about 4 disease. If you detect it early, that can be treated, especially a thyroid.
I was going to ask which of the 4.
Yes, immediately about the thyroid. One is the thyroid,
Right.
one is called G6PD, one is called phenylketonuria, and one is called congenital adrenal hyperplasia.
Okay.
So if you diagnose this disease early, the prevention, it is prevented. One of the known cause of mental retardation in children is hypothyroidism.
Right.
So if you detect at a birth, definitely a mental retardation is prevented, and since a law.
Prevented.
Yeah, we do a blood test. Just a card test. We heel prick the baby and collect the blood on the dry blood clot, and we test for a thyroid.
Right.
We get it in report in 72 hours.
Okay.
And if it is a positive, we treat it for thyroid disorder. This test was firstly started in India, in Jehangir and in Pune by Dr. Vaman Khadilkar.
Of course, yeah.
And still it is going on, so that we have prevented so much of the babies with the hypothyroidism, and the incidence is a bit high if you don't detect it early.
I see. But you're saying the treatment is fairly.
Yeah, fairly straightforward. Just
the
like
point is
thyroid.
detection.
Yes. So this is a preventive era. Even the same thing, we screen for the hearing at a time of a birth, screen for the eyes, because again, if you don't detect the hearing at a time of a birth, the child cannot speak.
Yeah.
So if you detected hearing at 1 year of age, we have lost the boat.
Right.
If in the vision, sometimes the baby may get a congenital cataract. And if you don't detect the vision at the time of a birth or 2 to 3 years, they develop called as a lazy eye or amblyopia. So even if you operate the cataract, the child, the vision is going to get affected. So these are very fragile period in the baby's life. And if you pick up it early, definitely the outcomes are very good.
Okay. So here you're saying the key really is test.
Yes, and this is no like blood test. Like in adult, we do lots of lipid profile and cholesterol. This is not like that. We need a proper treat by the pediatrician and a proper clinical examination. Usually, it gets picked up and the life become easy.
I see. So taking from that then, those are the most common ones in terms of what you're saying in terms of what can be detected and prevented.
Yeah.
What are the most common ailments that you see that come to your table today?
In the sickness wise,
Yeah.
sickness wise, more of you get is a respiratory infection because I deal with intensive care. We see lots of respiratory infection. This again, it is prevented. If you give a vaccine or a flu vaccine to the child, majority of respiratory infection, even a pneumonia vaccine which is available, we have seen the patient who are getting a bad pneumonia because of not treating the vaccine.
Okay.
So if you get a pneumonia, this is again a common presentation, especially in the winter or in the rainy season, we get a bad pneumonia. So these are the common presentation that can be prevented, and if you treat it early, definitely the outcomes are very good.
So vaccines is another thing that you're saying.
Yeah.
When does one typically take the pneumonia vaccine for a
No,
child?
see, a pneumonia vaccine as per Government of India guideline, it's given at 6 week, that is 1.5 month.
Okay.
6 week, 10 week, and 14 week. And the booster dose it given at the 15 to 18 months. So this is a normal standard schedule of the pneumococcal vaccine.
Right.
Second, pneumonia is prevented by giving a flu vaccine. We have lots of cases in the Jehangir who develop a flu and develop a convulsion also. Flu can be devastating. We had in 2009 a flu epidemic, swine flu epidemic,
Yeah.
and lots of babies are died.
Terrible.
So that is a vaccine preventable disease, and influenza vaccine is readily available. It has got 2 doses which is given 1 month apart, and it has got almost 90 to 95% protection rate.
Wow.
So that can prevent your normal flu, swine flu, that can be prevented, and one of the bad pneumonia, and it is a multifactorial that influenza can cause anything. We had one child in Jehangir who had developed a cardiac problem called as a myocarditis, secondary to the influenza.
Right.
And ultimately, it has leads to the dilated cardiomyopathy, and it is well known in the literature, and so it is known. So if you give that vaccine, it can be get prevented.
Wow. Okay. So what are the other kind of most common ailments? You're saying a lot of the lung related thing, but do you think is that also increasing because of everyone's talking about AQI levels and so forth? Is that also a factor?
Yes, that's also a factor, but it is more will called allergic bronchitis. It is more of allergic respiratory disorder in children that can be get because of all this pollution, change in a dietary habits, then preservative-rich foods. So that can increase your allergic tendency, and they get a recurrent cough, cold, and wheezing, which may be a trigger for the asthma.
Right. But again, you're again coming back to the preventive side of the detection, and then vaccines again being the main aspect of that.
Yes.
Okay. That's what else other than lungs? What are the most common ones?
Yeah, again, one more thing like preventive is obesity. We are seeing a lots of children with obesity and related to it. Yeah.
That young?
Yes. And we had a screen time related to the obesity.
Screen time, you mean like phones?
Yeah, either using social media,
Right,
and this can lead to the obesity. Nowadays, we are seeing a more child with obese rather than undernutrition. So this is again very concerning part because all the adolescent children are getting obese. Their BMIs are pretty high, and what the studies have shown that there is a direct correlation of the screening time with your obesity.
Wow.
So you start eating in front of a screen and eat, and then you become obese. Again, obesity can cause a multiple problem. It will be a triggered of your diabetes, triggered of hypertension. You get a PCOD in the girls.
Right.
So these are multifactorial. So this is again we need to be concentrated in the prevention about the weight of the child. So when you meet the pediatrician, we need to monitor their weight, height, and the BMI. That what usually we do as Jehangir.
And what when you say children, what age are you typically thinking of when you talk about children with getting obesity and so forth?
Yeah, it is very common. Even a 5-year child who is a toddler is pretty obese.
Wow.
So it is not like that the obesity is an adult. Obesity can be seen in a 2-year, 3-year, even a 5-year and adolescent also. So because all we are changing lifestyle and more reliable on the preservative foods and more screen time, these are all related to the obesities in the children.
Right. Well, coming back to you, Doc, you said that, I said that you're an intensive care specialist. Can you tell us some of the complicated cases that you've, had to deal with, and how again, parents can keep that in mind, and how we can prevent those kind of things?
Yeah, see, basically, we have a tertiary intensive care service, pediatric intensive care. We deal with all complicated cases.
Right.
So it depends on the epidemic. We had a bad chikungunya epidemic, so we treated all complication of the chikungunya in Jehangir.
Yeah,
We had
I had that myself.
Yeah,
but,
yeah.
I mean, I wasn't treated by you, but yeah.
But chikungunya induced brain infection, myocarditis, liver failure. We had a chikungunya induced liver transplant. He developed a liver failure.
Because of chikungunya.
Chikungunya, and he developed a liver failure, and we transplanted him. And this was a scientific paper which was published in prestigious Indian Journal of Paediatric from the Jehangirhospital. I am very proud of it.
Absolutely.
Secondly,
How old was that?
He was just a 1-year-old child.
1-year-old child that you did a liver transplant
Yes, it was done, and it was
incredible.
and the child is absolutely fine. So that was the things we deal with. Secondly, we deal with what we see in a dengue. Dengue child presented with a shock, landed into the complication, and it is a nightmare when a dengue child land up into the complication.
Yeah.
So again, a dengue can cause a brain infection. We have treated a children of a dengue, but even the key point in that, if you treat them in a timely fashion or in early, the outcome are very excellent.
Again, it's pretty much the theme of what you've been saying.
Yeah, and again, it is a multifactorial, not multifactorial, but multiple people involved, especially an intensive care nurse, a resident doctor, a trained staff, and all the equipment that we needed. So that's I'm very proud to tell you that since almost 17, 18 years, I'm attached to the Jehangir, and we had lots of very complicated cases we recovered very well. Even in the small babies of 800 grams, 700 grams, we recovered. We had a twins baby which was 800 gram, and one developed kidney failure. We have done a peritoneal dialysis of that child of 800 gram, and the child is 1 year. Just they celebrated birthday last month. So this give a enthusiasm, and we feel yes, I have done what I want in my life.
So fulfilling.
That giving us so much care and to the society.
Yeah.
So
I can't even imagine holding a 700 gram
yeah.
baby healthy. Forget what you just mentioned. So it's really, really incredible of what you do. Doc, any other stories that you'd like to share with us?
No, we had lots, but
you've got many stories.
This was very impacted me,
Yeah.
and that give you a boost to see, we can do it, our team can do it, and we will do it.
Absolutely. Like I have so many questions about the liver transplant of a 1-year-old. It's like that's crazy to me. I couldn't even think of something like that. So that's absolutely incredible, Doc. Any last words you'd like to leave us with? Any thoughts? that you'd like to...
Only thing is that nowadays parents are very apprehensive because they have got only kids, one baby. So the thing is that we should not miss any problem in the babies. So they should not even pamper the babies too much. We have seen the children, they are pampering, and later on they become some developmental issues.
By pampering, I mean like not letting them exposed to too much.
Yeah.
Let the immune system do its thing.
Yeah,
basically.
yeah. So the thing is that proper visit to the pediatrician, proper follow-up, clinical examination, not to rely much on your AI or your Googling.
Yeah,
That is a bit of a can lead to a complication in the children.
right.
Because the doctors spend half of their life in studying. So whatever they give is the best advice to the child.
right. Absolutely correct. Yeah.
So rather than relying, I message to the society is that rather than relying on your AI or on the Googling the things, it's better way, it's best to take opinion of the pediatrician, of your doctor, which is the best for your babies.
Absolutely. Yeah. That's absolutely, I think, the perfect way to end the note. And it's pretty much everything you said. Early detection.
Yeah.
Talk to the experts, and pretty much everything can be hopefully prevented in that respect. So thank you so much for everything that you do, Dr. Lad. It's been an absolute pleasure talking to you. And hopefully many more incredible stories
Thank
of
you.
these successes that come in the future
Yes, sir.
with you and everyone that hopefully we can encourage and promote in the future. Thank you so much.
Thank you so much, sir. Thank you.
Thank you all, and do join us next week. But before you do leave, do not forget to hit the like and subscribe buttons here at the bottom. And if you have any comments, feedback on topics that you'd like us to cover, please do not hesitate to write to us, and we will be happy to incorporate them. Thank you.